Hey, this is Sandy.
And Randy.
And we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase it all.
Join us as we share our world in sports medicine.
Welcome back to another episode of AT Corner. This is our first education episode of Season 3.
Yes, it is. And that means free CEUs. Thank you to Precision AT.
Yes, definitely. Just important note for this one, the CEU portion of it will be available the next day.
So if you guys are listening to this episode within our latest 5 CEU episodes, then this episode is free. After that, it will always be free to listen, but the CEUs will be available only by purchase, which also helps support the show.
Yes, absolutely.
Either way, you're going to head on down to the show notes for the CEU link, and also note that there's no bonus content for this episode.
Yes, I figured it'd be very boring to watch me sit in front of a computer.
So anyway, thank you so much for Precision AT for sponsoring these CEUs. And speaking of, what are we actually going over today?
Yes, so we are talking about training load. In particular, we're talking about how training load affects injury risk and even illness risk.
Interesting.
Yes, so our goals for this episode are to explain the complex relationship between injury prevention and injury risk associated with training load, discuss the injury risk associated with excessive increases in training loads, and discuss how excessive training loads may increase the risk of getting sick.
That is fascinating, actually.
Yes, and I figured it might be appropriate in the post-COVID-19 world.
Yes, also appropriate after summer training.
Oh, goodness, yes.
Or lack of summer training.
I do have to say, I have had a few people get sick, so maybe. Maybe we're looking at this.
Okay, so I feel like right now my biggest question is training load is a little bit abstract to me, so can we actually look at it and can you define it a little bit more to make it more applicable? Yes,
absolutely. So in particular, you want to start talking about what exactly is a load. And the International Olympic Committee actually did 2 very long documents on monitoring training load. And one of the big things that they wanted to hit on was giving a definition, because there's a lot of vague definitions out there, many slightly different from each other, that makes researching this topic a little bit harder. So they wanted to kind of like, hey, this is what it is, to make literature a little more consistent.
Mm-hmm.
So a load, as they defined, is the sport and non-sport burden as a stimulus that is applied to the human biological system. That's a lot of fancy words and a mouthful that no one ever wants to really talk about. But I do think it is important to highlight that they are taking into account the non-sport burden.
Hold on. I think I need some time to digest that because I still feel like it's a little bit abstract.
Yes. So essentially, how you should kind of look at it is basically any stressor can be viewed as a load, whether it's practice, whether it's, I didn't get a lot of sleep, whether it is my roommates are driving me crazy. All those things are a load. So I think, again, I love how they highlighted the non-sport component, because there's a lot of things that our body has to react to. So when we talk about training load, we're actually looking at the cumulative stress applied from either a single or multiple training sessions. So you're just looking at the training load that is associated with just training.
Mm-hmm.
And you're looking over a period of time.
Okay, that makes sense. So load is anything that
is life.
Right, right.
Load is life.
Is anything like basically that you take on. And training load is specifically your training. So like
exactly
a workout, a sweat session.
Exactly.
Okay.
So, but definitely keep in mind that non-sport part too, because working in athletics, right, we get so geared towards what's sport doing, but we do have to treat the whole patient.
I have a really good example of that because one of my athletes who I had in the past, I was treating him for concussion. He was first he had some pretty bad symptoms. He was staying at his girlfriend's house because she lived closer to school. And at her house, it was quiet. So he was recovering. His symptoms were getting a little bit better. But then he went back home. And I guess his home environment was loud.
Oh.
There were a lot of people. It was busy. And so that load from his house was affecting his recovery. And he actually started declining and started like regressing
That's tough.
on his recovery. So that is a perfect example of what external load would be, not
Yes, definitely.
not training.
Yeah, exactly. And man, that's a bummer, man, when home is supposed to be like your safe environment to like help with recovery is not.
Right.
So now that we kind of have a definition of load and training load, how load's being examined is there's two different types of load that are out there. There's external and internal. So your external load is an external stimulus applied to the athlete. So this is like your fancy GPS monitoring or something as simple as the amount of weight someone's lifting or the amount of distance they're running or how much time they're running for. So that's your kind of external. Your internal load is basically the athlete or the individual's response to that training. So this could be heart rate. I mean, if you really want to get into it, blood lactate, other histochemical like blood lab stuff, or even something as simple as the RPE or the rate of perceived exertion during an exercise session. So why these two are important to understand is because it really gears towards how do we monitor training loads. And there's a couple different ways you can do this. You can either use like the absolute load, so that's literally taking either the internal or the external load and just calculating that total without any application of how it's like the rate it's applied or anything like that. So if you had someone lift for like 3 sets of like 50 pounds, right? Each set, you're counting that 50 pounds to give you the total 150. We're good at math here.
Oh, that's 150.
That's 150. See? I'm good at math. We got this. Or you could even take it like, the distance run, right? Like you're calculating, if they ran 10 miles for 5 days, they ran 50 miles. Like you're just taking that absolute load that they did.
Okay.
Another way you can look at it is relative loads. So this actually takes into the account how the load is applied. And this is where the key information when you're trying to monitor training load is going to give you, like, this is the key information for you. This is their bread and butter, what you're looking for. Absolute loads can give you information, but when you're talking about, hey, let's analyze injury risk, kind of taking the relative load is going to be a lot more valuable. And this is the basic example of this is it's been kind of a popular buzzword when you talk about training loads is basically taking the acute to chronic workload ratio. So what's commonly used to create this ratio is you take the athlete's session RPE. So you ask them, how hard do you think that workout was? On a scale, there's different scales, but you can do a scale 1 to 10, and then you multiply by the minutes of training. That's the common way to do it. There's other ways you can do it. I've seen some people multiply it by the distance ran. Minutes is kind of easier, obviously, for individual athletes like track, because they run a long time. It may not be as valuable, but team sports usually use minutes of training.
Would that be like, well, here's the thing is like not every minute you're moving. So is it like minute, like I did a 30-minute training session, or is it like I did a 30-minute training session, but 23 of those minutes I was moving?
I think it kind of depends on how intense you want to get. Like if you want to be that technical and you have the capability to monitor that and track it, then that would probably be the better bet.
Mm-hmm.
But there's also like, most ATs don't have the luxury of being able to do that. They have like 20 teams that they have to cover and like, hey, how am I going to like... So you got to kind of have to game plan at what's manageable. I think whatever you pick, just be consistent within, like, roll with it like that.
Or is that what the scale is also used for? Like, I maybe did a lot of work, but I didn't work for that many minutes of... So I kind of take that into account. Like, I only trained at a 4 today, even though, like, I train harder, but I didn't do that long.
And I think that's the important part about the subjective piece. And we'll talk about that a little bit later in the episode because it does give a lot of valuable information because it is how the athlete's interpreting what they did as well. And it's the same thing too, is like you also have to kind of account for, well, what if someone didn't practice the whole time? Right? What if someone limited? So now you have to calculate their individual minutes as opposed to just being like, oh, well, practice was 3 hours today. I'll just do that simple math because that could affect someone's numbers. But so you have to do it whatever's within your means, I would say.
Mm-hmm.
So,
Can we just get a stat team, like, for games?
dude, that'd be
Can
nice.
we just get it for practice?
That'd be. I'm still trying to get like an insurance coordinator at my employer because that would be so nice.
That's luxury. I do it all myself. So.
Me too. That's why I'm really pushing for it. So like I said, this acute to chronic workload ratio has really been studied through team sports. So there's still some evidence lacking in like those individual athletes like runners and stuff. So keep that in mind, but it is a good baseline to start working off of. And essentially what they do with this ratio, because right, we talked about an acute and a chronic, is they use a rolling average from the acute phase. So they literally take each day in a week, average that, and then compare it to the chronic, which is usually about 4 weeks, but it can also be up to 6 weeks. So it's kind of how do you want to monitor it. So keep that in mind. That is kind of a limitation, is you can't like necessarily just get great information like right away. It's going to take a little bit of time because you need to build that chronic to understand where they're at. So that is kind of a big limitation here, but so far, everything that I've read, this is kind of like mwah, money.
So when would
chef's kiss?
When would you use this?
So this can be used just in your daily monitoring of your student athletes because it is a rolling average. The idea is that you ask them basically every day this question about, okay, how would you rate the session, and then multiply the minutes, and then that continues to give you that data that's going to feed into this. But we'll also talk a little bit later about, okay, well, I just don't have the time to do that.
Okay.
So we'll talk a little bit later because I'm trying to implement something similar to this, but also acknowledge I don't have the time to ask every student athlete, how was your workout today?
Right. A Google form.
I am using that right now.
All right, we'll talk about it later.
Yeah, we're on this. All right. So enough with the definitions. I'm sure everyone's like, all right, this is basically like starting with anatomy in our other episodes, basically.
We didn't.
Well, this is like the anatomy of training load, I guess.
Okay.
So the thing that people mostly care about is, okay, how does this relate to injury? Why do I even care about training load? Why am I going to take the time to monitor this? And again, like we talked about, it's divided into like 2 separate categories, right? Your absolute loads and your relative loads. So a lot of the initial work on training load looked at absolute loads. And the literature on this is pretty mixed. And some studies show that a high external load has a big increase in the risk of injury, which you would think like, oh, that makes sense, right? Like if you're doing too much, like your body's going to break down. Mm-hmm. But you know what's crazy is some studies show that a high load was actually protective of injury.
A high load over time?
Okay, so that's the part that, man, it's like you read ahead. So
I actually didn't.
So that's actually what we need to consider is absolute load doesn't look at the time. It just looks at your total load that you use. So like obviously they picked a time frame like, oh, what was the load for this person in a month? Mm-hmm. Right? But what it lacks is it doesn't look at how that load was applied. It just looked at how much you, like say how much you lifted, right? Or how much you ran, without saying how did you get there. So, and it also goes vice versa. Some studies showed that low loads, so having a very low load, actually increased your risk of injury as well. Mm-hmm. So not loading enough. And the reason is because it's not taking into how that load was applied. There's a difference between, if you say you have like 2 athletes that are both of you guys have lifted 1,000 pounds within the month, right? Mm-hmm. Well, take someone who arbitrarily increased their weight by like a pound each day or each session, right? That's a slow progression. That might be safe. Right. As opposed to the person who added 100 pounds every day, that person probably is going to be breaking down soon.
Stress fracture.
Exactly. So you see, there's that absolute load doesn't give you the full picture because you're not seeing how it's applied.
Right.
So that now goes into, again, the relative loads. And there's actually moderate evidence that supports the relationship between training load and injury. And with more research coming out, the last review that I read has stated that it's even strengthening this relationship. So you can feel pretty good that training load and injury does have some kind of association.
Like positive?
And again, that goes back into the trickiness of trying to identify this. Essentially, you're looking for a sweet spot.
Okay.
So if you have a low relative load, you can still increase your risk of injury because you're not applying load fast enough to protect the student athlete.
Wait, say that again.
So take those two athletes that I had, right? Lifting 1,000 pounds, right? That, say you're putting like half a pound every day to get to that 1,000. They may not be ready for that 1,000 appropriately. So at some point, they're not having enough load to protect themselves, or maybe they didn't get to that 1,000, but they needed to, if that makes sense.
Right.
So they're underloaded. They're underprepared to handle whatever weight they were given or whatever their athletic demands are. And then vice versa, right? Going back to the person who's progressing way too quickly, right? That can increase the risk of injury as well.
So basically, we should avoid the extremes and just stay in the middle.
That's exactly what this literature is saying.
So it's like Goldilocks. Don't train too much and don't train too little. You want to just train just right.
Exactly. And that's why calculating the ratio is supposed to help, because when you tell people like, oh, like you don't want to do too little or too much, the first question people are going to ask is like, well, how do I know?
Yeah, they're going to be like, well, I could have told you that.
Yeah. And it's true. That is basically what the research is saying is you don't want the extremes, right? You want a nice window. And some of the initial evidence on the ratio, on that acute to chronic workload ratio, says that the sweet spot to be most protective of injury and progress someone to get to higher loads safely is 0.8 to 1.3. Those are arbitrary numbers, right? It's basically using the most common way is the RPE scale times minutes. So at least it gives you something objective to look at. So then you can at least compare the numbers and be like, oh, this is where your ratio's at, and go from there.
So rate of perceived exertion times minutes, you want the exertion to be a little bit less than the minutes. Is that what I'm understanding?
So when you're looking at it like acute to chronic, you want your acute to be slightly higher than your chronic, but not too much.
Acute being...
like your week of training compared to your last 4 weeks.
Okay.
So you always want a little bit more than what your chronic load is, because that's how you adapt, right? You want to be constantly stressed. They found that anything that's higher than 1.5 actually increases your risk. So basically, if you're doubling your workload compared to your last month average, you are doomed. So
you should be doing about the same plus like 30%.
Yeah, like a little bit more.
Okay, that's a good way to put it.
Yeah, it's something that's doable. So you still want to stress them.
Like up to 30%.
Yeah. But that's the important thing with this literature is it's so individual, and we'll really talk about the individual aspect of it. So keep that in mind as we keep talking. The caveat with this whole ratio thing, one area is more research is needed.
That is an understatement on a lot of things.
Yes. The reason is because these numbers, 0.8, 1.3, 1.5, they're arbitrary numbers, but they're also found in a study of rugby athletes. So it's a team sport setting, right? It's not in a running sport or an individual sport. So there's a lot more that needs to go into this.
All the different positions.
Exactly. But it is a nice baseline. It gives you something to start with that you're like, okay, like I at least feel comfortable with what I'm supposed to be looking for, as opposed to, especially when a lot of this stuff came out, a lot of clinicians looked at it like, I don't know what to do with this.
Right.
Why, like GPS was big. And like a lot of the pro teams do it because they have the resources to do it. But you get all this data and you're like, I don't know what to do with this.
Right.
So that's how it relates to injury. Essentially, the message is slow progression. Don't rush into it. Now, for illness and the results for like just a regular kind of infection or upper respiratory infection, stuff like that, is similar to your injury results. Too much, too soon can increase your risk of illness.
But is that just like basic immune system? Like you run down your immune system?
Essentially, what's happening is your immune system's getting overwhelmed, right? Your immune system plays obviously important roles, But, it plays an important role in your recovery from exercise and your adaptation from exercise.
Mm-hmm.
So if you're like crushing yourself by like jumping into like a workout, right? Like if you were running 10 miles last month and all of a sudden you're running 50 miles now without progressing into that, your body's going to need to repair something. So it's going to have to go repair that. But now it's also trying to fight an infection. So what happens is your immune system essentially gets spread thin and can't cover all the bases. Next, what I thought was interesting was some viruses can actually be reactivated because your immune system is now not able to keep them in check. So now these other viruses are getting reactivated. One of them was the old mono, the Epstein-Barr.
Well, that makes sense because
it's always hanging around.
Right.
But yeah, so I thought that was definitely very interesting. So that's essentially why you're seeing that risk of getting sick. I know some people used to think that, after each exercise session, there was a window. But I think you really see the increased risk of illness coming from coming from too much load.
Well, I think this is interesting to point out because you're basically talking about physical stress and sickness, whereas usually we're talking about like mental stress could lead to illness.
Yeah, absolutely. Which again plays a role in training load. And definitely you should, talk to your athletes about what's going on in life, right? Like maybe the workout wasn't too hard, but maybe home life is making it feel like their workout's too hard. Right. Which then would show up in their perceived RP, exertion. Right. Yeah. So that's why using that gives you a lot of information without having to use like these fancy inventories that have like 20 questions that you have to grade and look at. So RPE can give you a lot of information based on what's going on in their life.
Mm-hmm.
So now we know that, training load affects injury risk. And we know that you can get sick if your training load's too high. So what do we do with this information? Right? Like, how does any of this information help me? And I think it's important to remember that just because we keep talking about an increased risk does not mean it predicts injury. The reason I would say that you really have to put this asterisk on it is because injury is a very complex thing just because humans are very complex systems. Many factors can affect an injury rate. And we've talked about it in previous episodes how, strength could be a risk factor, but it's not the strongest. All these other factors can affect it.
If we could predict injury,
we'd be rich.
Oh my gosh.
We'd be rich.
That's all you have to do in life.
Yeah.
Like
that'd be it.
I'm done.
So, look at the literature on any injury risk factors, right? There's not one that you're always like, oh, yes, this one, right? There's always some conflict in this context, it might. And I think the reason is because it also relates back to training load. If you have a high training load, all those other risk factors that in the literature say like, oh, that might increase your risk of injury, probably get amplified. So like take the person with knee valgus, right? One moment of knee valgus will not tear your ACL. Right? It comes from over time and then all of a sudden, boom, there's that one. Well, if that person has a high training load, all of a sudden that knee valgus might be happening more. They can't get out of it or they can't control it. So I think that's why you really have to take this information and like obviously keep an eye on your student athletes who have that ratio of like 2.0 and they're like, maybe they're even in the threes, basically like crushing it too much. Right? But if you have someone who's perfectly healthy, no injury history, younger age, all that fun stuff, they might be at a lower risk than, say, your athlete that's on their third ACL reconstruction, right? You might be a little more worried if that person's workload gets a little bit higher. So I think that's the important thing is know the student athlete history because more than likely if someone has an extensive injury history or has some of those risk factors that you're worried about, like say they have some knee valgus or they're have low hamstring strength or low glute strength, right? A higher workload might affect them more than someone who doesn't have that history.
I feel like sometimes it's good to point out stuff like that.
Absolutely. And that's what really this information should be used for is it helps guide your decision making on your individual athletes as opposed to it's not the law.
I do have a question about, you know how when you send someone with back pain to go get imaging.
Yes.
And they find that, like, their disc is bulging or, like, something's happening.
Yes.
Or let's say they're not having back pain, but then all of a sudden there's something going on their back and, like, they have imaging.
Yeah.
And they're like, oh, you have a herniated disc. And then all of a sudden they're in their head and they have back pain and stuff. Do you think this would relate? Like, oh, you have a lot going on outside of training. Oh, you are going to have a hard training session. Oh, we're going to point out all this stuff. Do you think that could play a role in how they perform, or 2, how much they exert, or 3, injury risk?
You know, absolutely. I think it might. Because, yeah, the whole mental component does play a role. Like, same thing in, like, the back pain patient, right? There's a huge mental component to that. They've already seen that, like, those in back pain have higher levels of depression or anxiety. So they definitely can go hand in hand. And I think that's why it's still important to obviously get the student athletes or your athletes or patients involved in this, but also educating them on, like, what kind of range they're supposed to be at. And, like, just because you're way out of this range doesn't necessarily mean this is a bad thing. It just means we don't want to stay in this range very long, right? Like, if you have a moment where you're, like, at 1.5, that doesn't mean, like, oh my gosh, I'm going to get hurt. Today's the day I'm getting hurt. Or that doesn't, I thought it was interesting because they, in some of the literature, they really pointed out, just because you're at 1.5, oh my gosh, we can't train today. No more training. We got to bring it down. No, that's not the case. It's just like, okay, you see a spike, you're trying to avoid spikes. Hey, let's bring it back down a little bit, right? We did a little too much. Let's work our way back down. So it doesn't mean like, okay, we're at this threshold. That's it. We're done. No more.
Right.
Because that's also not a good thing. Because obviously if you just go from a huge spike to nothing, well, then your next training session, if you're trying to do the same thing, is another huge spike.
And then you don't adapt.
And now we're just going into a vicious cycle where I actually am getting overloaded because I'm doing too much of a knee-jerk reaction, too much extremes to just be like, oh, no training. So yes, definitely. But I think it does go to the educating part. Like, hey, this isn't great, but it's also not the end of the world. We just need to adjust. That's all.
Okay, so now tell me about your Google form.
Yes. So that was an important thing that I wanted to bring up is when we talk about training load, and like I've sat through like the educational sessions at like conferences and stuff, great information, but I feel like you leave it like, okay, so that's going to be a lot of work and I don't have time to do that, or that sounds really expensive. What I've started doing, and I think what's really important for anyone who's interested in trying to monitor training load, is I kind of created my own Google form, and it's just simple questions of like, hey, do you have pain? Do you have muscle tightness? Like stuff like that. And then also some mental health stuff like, oh, like anxiety and like stuff like that, or changes in mood. And it's like 10 questions, and I send it out to my student athletes at the end of each week, and they just rate it 1 to 10. And I'm not multiplying anything. I'm just literally taking the absolute internal load, which again, we already talked about, like absolutes and relative, probably, different. But it gives me some information, and it's a start. And what some of the literature has shown is like, yeah, the objective stuff's great, right? Like we all love objective numbers, GPS monitoring, all this, like real numbers are great. But also the subjective information has been shown to be a little bit better than the objective numbers, because of how much is incorporated in subjective measures. When you ask someone how hard their workout was, their answer is a reflection of the actual workout, but also what's going on in their life, how their body's affecting how they feel. If they're feeling weak, right, that workout probably was pretty hard. So this subjective information, like if you had to pick one, like if you're trying to make some kind of monitoring, you had to pick between objective and subjective, I'd almost say take the subjective one first. And it's a lot easier to keep track of.
Right. Do you make it optional, or is it mandatory?
I would like it to be mandatory, but I don't hunt the kids down. Like if someone didn't do it, I'm not going to be like, hey, do the form.
Do you have a pretty good, like...
I would say so. I can't remember the number. I think I sit around almost half.
Is it just your soccer team?
I'm just doing it with one team right now because I want to see how it goes.
Okay.
I want to see if I can keep up with it, see if I can use the information appropriately, and just see how it works out.
How long have you been doing that?
This is week 5.
Okay.
Yeah, so I've been doing it for a few weeks. I still need to I'm going to try and calculate a acute chronic thing. I don't know if I'll be able to in a week, because I only do it once a week. I don't do it every day.
Right.
So I've actually really liked it because it gives me an idea of where people feel they're at. And I can communicate to the coaches like, hey, maybe keep an eye on this person. They're feeling pretty sore or stuff like that. And I think that's important that I wanted to remind the student athletes is this information's for me. It's not going to the coaches. The coaches aren't grading it. I give them a general idea, but the numbers and stuff, I don't send to the coaches.
And you don't send to the athletes either, right? The athletes don't see their numbers?
No, they don't see their numbers.
They just are asked to reflect on it, basically.
And the only thing that I send coaches is basically a color system. So if the in this range it's green, in this range it's yellow, in this range it's red, and that's all the coaches see. So they don't see the actual numbers. And I took out I don't let the coaches see the mental health portion.
Mm-hmm.
So I wanted the kids to feel comfortable that coaches aren't checking up on them. So I don't want them to lie on there. But I do send the coaches just hey, this is where this person's kind of at. So I think what's important to note there is if you're thinking about, okay, I want to kind of start monitoring training load, but all this sounds really complex and I don't have time and, that's a lot. I think just starting with something as simple as that, I think gives you a lot of valuable information. If anything, you can definitely catch kids who might be having some mental health stuff that, maybe isn't a huge deal right now, but you can keep that in the back of your mind and reach out to them and be like, hey, I noticed the past couple of times we've done this, you've answered this way, hey, are you okay? And so stuff like that. So I think that's a great start. And so far I have enjoyed doing it.
Is it something that you feel can one day be kind of hands off? Once you set it up, you kind of just can check it and send almost a quote unquote report, hey, this person is, you just look at it? Or do you actually have to sit down and compile the data, or do you kind of have it automated?
I'm not super tech savvy, so there's a lot of manual compositions. I could see how it can be automated. But
Want me to take a look at it?
I think you might need to, because I'm not the most tech savvy. I mean, it's just Google Sheets, but I'm not the most tech savvy. So I do think the potential for it to be automated is there. It's just my limitations make it a little more manual.
Well, if you guys have any ideas of how to make
Help
it from, or what you guys are doing, then make sure you put that in our Facebook group. If you're not a part, it's facebook.com/group/ATcornerPodcast. I know that there are some athletic trainers I've heard of who've sent out Google Forms for various things. Some people do it daily. Some people do it weekly. Some people do it monthly.
And I think that's the important thing, too, to remember is when we're talking about training load, again, remember, subjective and just asking the athlete gives you a ton of great information. It doesn't even have to be something intense 10 questions. Literally one question, how are you feeling today, could probably be used as your training load monitoring.
Right.
And it can give you so much information. So anytime you dive into this literature or see sessions on it or try to learn more, right, it just sounds so complex. And you're like, oh my God, I'm doing math. And I just want to know if my kids are okay. No, literally starting with just one question, I think gives you so much information, and it's a great start.
Well, you could probably even do 2 questions, how hard do you think you trained today, and how much stress are you in outside of training? And then you can even take that and be your 2 loads, and you can make that an easy chart.
No, absolutely, 100%. And I think that's really why I wanted to do an episode on training load, is because it sounds more intimidating than it actually has to be. Now, you can make it as complicated as you want. You can, there's some people that have looked at, you can actually, with using that ratio, if you sit down with your coaches, right, and get their practice plan, which, by the way, ATs have a hard time doing that as it is, because I feel like coaches don't even have a practice plan until that day.
Yeah.
But there's even some literature that says, looking at okay, you can have a planned ratio, so what the coaches are thinking the plan's going to be, and then compare it to what the actual ratio is. So it does help with monitoring practice, and like coaches can see like, oh, like we planned for this, but it's actually doing this, we need to adjust.
Right.
So you can make it as complex as you want, but I think for most people, training load can be intimidating. So I think, like you said, a question or 2 questions, that's a great start. I think that's a great way you'll get a ton of information, and plus you're doing more than just like kind of like guessing. You're actually going into it like, hey, I'm looking for something.
Well, the reason why I asked if it was automated is because obviously you and I work at very different places. So where Randy's working, he's the director of sports medicine. He's got 6 athletic trainers. He has, you have like 2 sports that you're working with? Like one in the fall, one in the...
I mean, technically 4, but 2 of them, like, let's be honest, they're not coming in. So basically 2.
So like mostly one sport at a time. Whereas I am at a junior college. There's only me and another full-time.
And football.
And we're lucky to have a part-time.
Yes.
And we have 14 sports. So
and football.
And football. You guys don't have football. So
no. Dude, no.
Exactly. So I mean, like, if it was an automated thing that I can just say, hey, coaches, can we send this out to the athletes, as kind of getting an idea of like how this is, you know, if it's something that I can just like look at their responses, or look at a chart that's like, because if you do a Google form or what else you use, I'm just more familiar with Google Forms, and put it into an Excel or Google Sheets, whatever, and have it automatically put it into a chart or automatically generate a report or something, you actually don't have to do anything on the back end. Like once you set it up, if it's automated, then you can kind of just, and not even, you can just like look at who's read and be like, hey, by the way, this person has been read for a while, or, you know, half your team is read. Maybe take it easy this week.
Maybe let's back it down a little, coach.
Right. And I think you also have to pay attention to like, where do you stand with your coaches? Because I know a couple of my coaches would probably be like, oh, this is great. But I know a couple of my coaches who would be like,
this is dumb. Back in my day.
Don't tell me how to coach.
Also, you'll get back in my day.
Right. I think as long as you frame it as, you know, I'm just worried about injury risk, like preventing injuries, instead of like, this is how much load you should be doing.
Yeah. Well, and also, like you said, like how you talk about it, but also, so if you do have that resistance, right, that doesn't mean you can't keep monitoring it. Because what I'm trying to do with this, and the reason I'm not like going like super in depth with certain things, is because I'm going to try and use this to collect some data. So like this is where it gets really nerdy. You know, I'm trying to see like, okay, we have these injuries. Where were their numbers at around that time? Mm-hmm. And then I'll do my best to remember SPSS, and then see if we can find a statistical significance.
I barely have time to answer emails right now. That is like...
I told you, this is where it gets nerdy, but it's part of the data collection process. Right. So what I'm thinking is like, hey, I can use this information, because I do know we have coaches on staff that would be resistant to this and think their teams are all Olympic D1 level athletes, and be able to show them like, hey, we have athletes who reach about this number. They are more likely to get hurt. Maybe we should not reach this number as much. So that's what we're going to try. I'll keep you posted. I feel like
it's more individualized, though.
It is.
I think you'll probably end up using it more for like, hey, the team is pretty beat up right now.
Exactly. And that's the idea.
They're reporting that they're pretty beat up.
And that's the idea of this, is being able to go like, hey, here's what your team looks like. I think we should slow it down a little bit.
Right. Is that the last topic?
That was it.
Do you have an action item?
Yes.
Season 3 action item.
Yes. Overall, training load does have a relationship with injury. Essentially, you're looking for the sweet spot. Stay away from too much too soon. So if you have kids that like, oh yeah, last week I ran 10 miles and all of a sudden they're trying to average 50 miles this week, that's too much too soon. Right. But also stay away from the not enough.
Goldilocks.
Yes, because if they're underloaded, they're underprepared, and they can actually increase their risk of injury, which we didn't tie into the rehab portion of it. But again, that ratio is really good to help you with rehab because it gives you an idea of how much someone's working out as they're returning to play. So it helps give you an idea to structure your return to play a little bit better instead of kind of that guesswork like, oh, well, how do you feel today? And like, we are very good at that, but at least this gives you a clear number you're kind of shooting for.
Okay, I have to make this analogy, and I didn't want to make it in the middle because I wasn't sure how long it was going to take, and also I feel like it's not going to be applicable to like a lot of people. But you know, this is the end, closer to the end, so yes. I feel like anyway. So I couldn't help but while you were talking about this, like really I resonated with it because today, even just today when we were rock climbing, so Randy and I go rock climbing.
Yes.
A lot of this is so applicable to what I was feeling today.
Yes.
And so we had our official like vow renewal, I guess. Wedding, our white dress official wedding ceremony in May of this year. And in preparation of walking down the aisle and making sure we made it down injury free, we kind of stopped climbing because
no boots.
We don't want to fall off the wall and like
be in a boot
or crutches, you know. So a lot of that meant we lost a lot of strength. Like I am not nearly at the same level that I was at before.
Yeah.
And now trying to go back and trying to build up that strength, it's so easy for, I feel like on the wall it's so different because like you know how you go work out and then you don't work out for a while and then you go back and you're like, oh, I'm just going to kind of do the same stuff. When you go climbing, it's like you are holding yourself on the wall.
Yeah.
Like there's no way, and we do bouldering, so we do it without the rope.
Oh yeah,
so,
I'm afraid of heights.
So there is like no way that I can attempt to do my old like level.
Yes.
Because of where I'm at. Yeah. And yes. Because like I'm not trusting my strength on the wall. I'm not able to do the same things. And a lot of things that you were saying, it really resonated with me with the climbing because like today there was like a move that I would have been able to do if I could have done like one more pull-up than I can do right now.
Yeah.
But I wasn't able to do that. I wasn't able to hold myself on the wall. But that's not something that like a soccer player, yes, you have the muscle memory, but where's that endurance? It's not as like
right. You can't
obvious.
Yeah, you can't just jump into your full 2-hour practice, right? You're going to be crushed by the end of it.
Right, but I think that it's not like it takes a lot of self-reflection. Whereas yes. Like I'm literally holding myself on the wall. I kind of have a better idea of like limits. Even though it's frustrating. Whereas, yeah. Like, I feel like in, like, soccer, basketball, like, your traditional sports, you're not really getting that feedback as much. Like, yeah, you might be a little bit more tired, but it's not like you're going to fall off the wall.
Yeah.
And so I feel like that self-reflection is a lot harder in like, sports that you kind of, like, if you took a break from them and you come back to them, because that exertion is a lot different than, like, can I do this or can I not?
Yeah, and again, sorry to keep referencing the ratio. I feel like we should put that in quotes, the ratio. But again, that could also be an education tool too for your student athletes that are returning who, like you said, like those team sports, they may not feel that limitation, but educating them on like, hey, this is why I'm doing this. This is what I'm shooting for. And actually, when you were talking about that just now, it made me think of like, okay, like maybe doing a team thing might be too tough right now. Like maybe you just don't have the time, the resources to try and pull that off to the level that you want to or anything like that. Maybe starting to look at workload on your return to plays, right? Mm-hmm. Just you have it, that could be a good start. And it's a super controlled environment, right? Like you're controlling what they're doing already and you already check in with them. Maybe you just start monitoring their workload as your start to get comfortable with it. So there's a lot of different things you definitely use and play with to get comfortable with it.
I think I just really like the idea of the self-reflection.
I do too. I think that's a good idea. And again, it puts it back on, I don't want to say puts it back on the athlete, but it takes the athlete's experience into account.
Right.
And I think that's one of the most important things that sometimes gets overlooked when you work in athletics.
Right. Do you have anything else?
No, I think that was perfect.
So if you guys are new, we do every other episode as education or stories. So this one was an education. It was a CEU episode. Again, the link for the CEUs is down in the show notes. Every other episode is a story episode, and that's where we take stories from our listeners, take stories from our Instagram followers, AT Corner Podcast, and we put them together and we go on different feature topics every week.
Yes.
So if you guys want to submit a story, make sure you head over to our Instagram at AT Corner Podcast. We have some really cool ones coming up.
Yes, we do.
And again, don't forget to stop by our Facebook AT Corner community.
Yes.
So you can weigh in on some of the things that you guys are doing on Training Load.
Yes, absolutely.
Cool, Randy. You want to finish it off?
Yep. Thank you for helping us showcase athletic training behind the tape. Bye.